The workshop saw the attendance of volunteers from all over the country and aims at educating the volunteers on tuberculosis and also creating a network of volunteers for health advocacy. Executive Director of Debriche Health Development Centre, DHDC, Deborah Eke, said the advocacy will be replicated in many countries all over the world.
Today, we would have the opportunity of hearing from people who have survived this disease. However, there are people that their lives were lost to this disease.
Dr. Emmanuel Okpayemi of the World Health Organization shed more light on tuberculosis.
If you look at during the course of the presentation, I did talk about cough, talk, sneezing, right? And I say each time you say you sneeze, that about over 4,500 bacilli are released. Release covering certain distance. So velocity is distance over time. So you are looking at it, the propulsive force. And that is why sneezing is particularly more dangerous. Why? Because of the tussive power that pushes it away. So when you say eating, instead of saying alhamdulillah or God bless you, you are either to escape and cover yourself or cover your nose. Because the speed, the distance the bacilli had covered within that period is usually very, very long. In terms of contact management, we say 8 hours. So when you have somebody staying in the same place with the same persons and the bacilli and they are coughing and sneezing to each other and they are getting into contact with each other, it's an average of 8 hours that you would know you are much more at risk.
Dr. Jamila Amin, representing the Coordinating Minister of Health and Social Welfare, spoke on the importance of youth inclusion in health advocacy.
They have high incidence of this disease, plus low awareness. They are very much affected, but the awareness is very poor. It's about 17%, the last data I checked. That awareness means, do you even know that TB exists? Do you know the signs and symptoms of TB? Do you know how TB is transmitted? Awareness is very poor in this category of people, and unfortunately, they have a very high incidence of the disease. They are the agile population.
Highlight of the event was a 1-minute silence held in honor of the victims of tuberculosis worldwide and also the distribution of certificates and toolkits to young TB volunteers. Fauzia Lukman, reporting for Global TV News.